some list of symptoms that you might experience if you have a hemorrhagic stroke, like Dr. Linfante was talking about. Let's break those down a little bit. His worst headache of my life, that's actually how you described it as well.
That's how the patient described it.
and stiff neck, dilated pupils, pain in the eyes. Talk to us a little bit about this.
So, I mean, what the viewers, I always explain to my patient, because it's difficult to understand if you're not a physician, is that the aneurysm is like this bubble that bursts, but then the body fixes it. So you have a temporary, so it bleeds out and then it stops, because the body makes a little bit of a patch to this bubble that bursts. However, if you don't fix it completely, then this bubble will burst again. So it depends how much blood there is in the first place. So if there's a little bit of blood, patients have headaches, and maybe some nausea and vomiting. But if there's a lot of blood, is in this moment of time, the aneurysm bleeds a lot, then there's all the other symptoms: loss of consciousness, coma sometimes, alteration of consciousness. Patient has to be intubated. It becomes an emergency. It depends how much blood gushes out inside the brain.
You often hear patients who experience aneurysms or a stroke complain about sharp pain in the leg, a change of mental status possibly. Is that some of the common symptoms that we see?
So the first thing is a headache. So all the symptoms, if you don't have the worst headache of my life plus, these are all the symptoms. It's the worst headache of my life plus. So you can have other things. You can have sometimes back pain because the blood kind of comes down in the back of your spine. So back pain, leg pains, but they're not that common. But nausea, it's a worst headache of my life, nausea and vomiting, alteration of mental status, and this type of symptoms. Changes in the way the eyes are, or sometimes weakness on one side or weakness on the other side. But the most important thing is the worst headache of my life. If you don't have that, then it's very unlikely there is a ruptured aneurysm.